Many are experiencing grief. And so I've decided today to talk a little on when healing hurts. Grieving as a nurse can be very traumatic. Last week I spoke about resources in the Empowering New Nurses book for new nurses. And I know for sure that for a new nurse, experiencing this, seeing a patient dying, can be traumatizing. It can be traumatic at times. And so today, I'm looking at us having a mind shift. There's a different tone today because yesterday I actually experienced another death. And I know the nurses were so empathetic. They worked so hard. And so nurses do grieve at times. Nurses do grieve, but many times it's not processed because they keep going. And so today I just want to directly say thanks to all of you nurses who have been contributing in so many ways in helping the patient and their family go through this season. I'm emotional somewhat because it's a close friend, my friend's daughter. So I'm encouraging us nurses, interprofessional team, all those who care for others, to keep doing your best. And your reward will come. We thank you. We appreciate you right now. Thanks for all that you do in helping humanity. This is from the Empowering New Nurses show with Dr. Miriam Amanda Smith, the host for Empowering New Nurses. New nurse, be encouraged. With experience, you'll be able to cope even more as you move through this journey of nursing, the nursing profession. Thank you. How can you connect with me? If you have something to share, certainly Miriam Amanda Smith on YouTube. On podcast, it's Empowering New Nurses. And on Instagram, it's Podcast Mir. Look forward to hearing from you. Share with a friend. Share with another nurse. Share with one who is grieving. We know that definitely it's the only time we accept that will be at the last. So we go through all the different processes of grieving. All the different processes of grieving we go through first. We bargain. We negotiate. We do all of those. But the last thing is to accept that it's real. And especially when we have lost young ones, young moms, to that terrible big C. You know what that is most time. So let us get our mammograms done. Let us do our screening. Let's encourage others too. Let's be an advocate for our patients. We appreciate you. We appreciate you. Hi, Keith. Hi, Keith. We appreciate you for all that you do. And I just want to say thanks again from the Empowering New Nurses platform show that you should keep doing what you're doing and be empathetic. There comes a time when it is so painful. It's so hurtful. And we have to cope. And many times we neglect ourselves while we are emotionally going through all of that. Connect with me on YouTube, Miriam Amanda Smith. Send a suggestion, send some greeting, some love. On Podcast Mirror, that's Instagram. And on podcast is Empowering New Nurses. The book Empowering New Nurses is on Amazon. You can get your copy. There's an area in it that deals with grieving. And I know many individuals, if you're like me, you have experienced grieving and it continues. And it's a part of life. But how do we cope? There's so many different ways of coping. And so I'm just encouraging you to embrace someone, tell someone you care, show love, express love. It's not too hard. Have a blessed day today. Subscribe to my channel and share it with someone. Kate, go on my YouTube. Remind me of who you are. There's so many, being an educator for so many years, I've met so many different individuals. And so I'm somewhat emotional right now, as I said before, because I'm grieving too. But I have to encourage someone that if you need help, get some help, professional help, support from all different means, whether it's a support group or whether it's a clergy or pastor or social worker or counselor. If it's getting too painful, of course you're going to pray. I believe in that 100% and more. So, but apart from praying, the Lord has allowed other people to be trained to be able to help you under these circumstances. So, thank you. Share this with someone today. Go on YouTube. I'm looking forward to seeing that subscription. On YouTube, Miriam Amanda Smith. Dr. Miriam Amanda Smith, of course. And you're going to subscribe and you're going to share it with someone. Many are grieving, and you can recommend that episode or this episode to them. You can. And so I look forward to hearing from you and your subscription. And for those other young nurses who are coming on board, I just want to remind you and inform you that coming out soon, from my experience and other experiences of others, I will be sending out a small workbook on EKG interpretation. And that can be challenging for some individuals, but I'll make it simple, step by step, coming soon. So look forward to seeing and hearing from you. Feel free to put a topic that you would like us to discuss. And I would like to have you, to interview you too. If you're a young nurse or you're a seasoned nurse, to come on my channel and we can talk and we can share with the world what nursing is all about and how we can help even better as we advocate for our patients and ourselves. Thank you. Have a great afternoon. Hi, Kate. Send something to me and let me know and reminded who you are. Thanks. Bye-bye.